Hello, my name is Samantha Figueroa, and I'm a nursing student for Seminole State College. Today I'll be administering medication by subcutaneous injections. Subcutaneous injections can include the posterior aspects of the arm, the abdomen below to the costal margins to the iliac crest, and the anterior aspects of the legs. The patient today I'll have is Oscar Simpson. I'm cleaning my hands beforehand before I go onto the computer and see what medication he's scheduled for today. Alright. I see that I have Oscar Simpson, my patient. I see his date of birth is XXXXXXX, and I see he's allergic to pollen and codeine. Alright, okay. I see that he's scheduled for a medium dose of insulin, lispro recumbent, and it's before meals and at bedtime. The route is subcutaneous, and it is scheduled for now. It is 1900 right now, so it's almost time for bedtime. So it's good time to give this insulin. At the same time, the patient does have a blood glucose level of 200, and there is an order for a medium dose insulin, and based on the sliding scale, they need 4 units. Alright, so based on that, I'm going to go in the healthcare provider's order and verify the information. Okay, there's the same information, shows the dosage, the frequency, the administration instructions, the route, and the sliding scale that the patient needs a medium dose insulin, and glucose level is 200. Alright, now I'm going to go to the MAR, and now I'm going to get to the medication needed for the patient. Alright, I have the medication here. Next, what I'm going to do is I'm going to do the patient's 5 rights. First, the patient is Oscar Simpson. Next is the medication, which is the medium dose insulin, lispro recumbent. Okay, the dose and frequency is before meals at bedtime, and based on his 200 glucose level, the patient needs 4 units of insulin, and its route is subcutaneous. And the time, it is 1900, so it's almost time for bed, so it's scheduled for now. Okay. Alright. Now that we have that, next is, this is a vial. It's a multi-dose vial, so that's what we have here. Next is that I have calculated it. It is 4 units we're going to be taking out. Next is that it is not expired, and what I'll be using for patient education and medication resource is my drug guide. Here it will show what the medication is used for, the action assessments I needed to do beforehand, the adverse reactions, and the potential patient teachings that I need to do. Such as, let's see. Okay, so right now this medication is for the control of hyperglycemia. It is to lower the blood glucose levels. The adverse reaction would be cause hypoglycemia or hypersensitivity reactions, which can include anaphylaxis. I have to make sure that I assess the patient for any tingling of the hands, mental status such as confusion, touching of the skin to make sure that it is not pale, cool. Make sure to see if the patient is irritable, if they have not tachycardia. I also have to make sure to see, I have to monitor their weight periodically. I have to also monitor their blood glucose levels every 6 hours. And I have to monitor their serum potassium. Okay. And then, yeah. Okay. So now, that's what I have to look for. Now that I've done that and I've calculated the medication, I know what I'm looking for. Next, I have calculated the medication. Now I'm going to look for what type of subcutaneous injection location I'm going to do this. I'm going to do the anterior aspects of the thigh since the patient has enough adipose tissue. The anterior aspect of the thigh can take 1 milliliter of insulin, and the needle is about an estimation of 1/2 to 5/8, and the gauge is 25. Alright. And here is the needle necessary. Since it's an insulin, it has a special needle because it is units. There we go. I'm going to clean my hands again. Next, I'm going to also do, again, the second MAR. So, like I said, the patient is Oscar Simpson. The medication is a medium-dose insulin lispro recumbent. The dose is 4 units before bedtime because it's 1900 right now. The route is subcutaneous at the anterior aspect of the thigh, and it is scheduled for right now. And we calculated the medication. Okay, so next thing I'm going to do is I'm going to clean my hands and we're going to get started preparation for the medication. Next, I'm going to get a alcohol wipe. I'm going to take this off and I'm going to, okay, sorry, it paused. Here is the medication. I'm going to take it off. I'm going to dispose of it and I'm going to clean it for 30 seconds and I'm going to leave it on here. Oh, I have to get another alcohol wipe because it did fall off. Alright, now that we have it, we go back on here and leave it on here. Next is I check the integrity of the packaging of the syringe. It is not damaged. It is necessary for the medication. Okay. And it is not expired. Alright, now with this I'm going to dispose of it. I'm going to actually pull it back 4 if possible. It's kind of hard here, but I got it here. Alright, now I fill up 4 air and then I'm going to go rainbow and insert it into the vial, and I'm going to put in air, making sure that no air touches the liquid. Okay, and I'm going to be very careful so I don't injure myself. Alright, so I'm going to push the camera here. I'm going to do the rainbow. Take off the cap. Take off the alcohol pad. Dispose the alcohol pad. Push this in here. I'm going to be very gentle because the needle is very, very delicate. I'm going to push air in. And then I'm going to do eye level and take in some fluid. There we go. Alright, I got it. Now that I got it, I'm going to put the cap here passively so I don't injure myself. I take it out and I'm very careful not to dirty the syringe or injure myself. Next thing I'm going to do is, since it's a multi-dose valve, I'm going to put there we go. Couldn't find my pen. Next I'm going to put the time, which is 1900, the day 11/11/2020, and my initials when it was last opened, the since it is a new valve, I'm going to have to do that, and I put it on the container. Alright, now that we have the syringe with the medication, and here we're going to next put I'm going to get some tape and I'm going to put it together, because at the end of the medication I'm going to have to put the lot number and the manufacturer for the documentation. I'm also going to have to put the patient's, there we go. Next I'm going to have to put the patient's name, the medication, the dose. Okay, so we have the patient, Oscar Simpson. The medication is medium dose insulin lispro recumbent. The dose is 4 units, and it's at bedtime. The time is 1900. The date is 11/11/20, and it's my initials. All right, and now we have here the medication. Now we have it here. All right. Next thing, before I go to the patient's room, what I'm going to do is I'm going to get a woven gauze sponge just in case for any bleeding. Next thing I'm going to do is also get an alcohol pad to cleanse the skin. And the gloves are provided in the room, and hand sanitizer is provided in the room. All right. Now that I have all my necessary materials, I'm going to go inside the patient's room. Can I come in? Yes. Hello, my name is Samantha. I'm a nursing student. I'm here to administer a medication by subcutaneous injection. Okay? Okay. Can I get your full name and date of birth, please? Caesar Simpson, XXXXXXXX. Okay, can I look at your ID bracelet, please? Yes. Okay. Alright, now I'm going to compare the chart. Alright. And, Oscar Simpson, do you have any allergies? Oh, yes, pollen and codeine. Okay, and what happens if you were to be exposed to pollen? Oh, I swell, my throat swells and I get itchy and red. Okay, I'll make sure that's jotted down. And, what about codeine? You said you were, allergic to codeine. Oh, yes, it just makes me itchy and, headache. Oh, okay. I'll make sure that's jotted down too, okay? Alright, now I'm going to make sure that the bed is in its lowest position. The bed brakes are on, the bed rails are up, and he has his collate that is reachable. Okay, so Mr. Simpson, the healthcare provider, put a order for a medium dose of insulin, 100 units per milliliter. The healthcare provider believed that it was necessary for the control of your hyperglycemia since your blood glucose level is at 200. The dose is at before every meal and bedtime, and since you are going to bed at this moment, I will be giving you the medication. The route will be subcutaneously, so in other words, I'm going to do it at the anterior aspect of your thighs. Is that fine with you? Yes. Okay. Have you ever had insulin before? Yes. Okay, and have you had any reactions to it? No. No? Okay. Alright. Okay. Now I'm going to clean my hands again. And I'm going to close the privacy curtain and close the door. Okay. Alright, like I said before, Mr. Simpson, the healthcare provider put an order for medium dose insulin, lispro recumbent, because your blood glucose level is at 200, is at 200, and I'm going to give you 4 units of the medication at your anterior aspect of your thigh. It is a quick procedure, and it's going to be done for before meals and at bedtime too. Okay? Okay. Alright. I just want you to know that potential side effects is, hyperglycemia and hypersensitivity reactions. Okay? If you ever feel like tingling in your hands, lips, tongue, you feel cold, or you feel like your mental status is a little more irritable, or you feel drowsy, make sure to notify any of the healthcare providers here. Also, I'm going to be monitoring your body weight, as the medication can affect your weight, and I'm going to have to check your blood glucose levels every 6 hours. Okay? Okay. All right. And also, I want to make sure that you know the signs and symptoms, and yes. Okay. Alright. And I just wanted to know that since it is a subcutaneous injection, I am going to have to rotate injection sites. So since I did it at your anterior aspect of your I'm going to do it at the anterior aspect of your thigh. The next location would probably be your posterior aspect of your arm, or the abdomen below to the costal margin to the iliac crest, like around here. Okay, that's fine. That's fine? Okay. Alright, so next what I'm going to do is I'm going to do the patient's 5 rights again. I'm going to clean my hands again. Alright, so the patient's name is Oscar Simpson. I'm going to look at your ID bracelet here, okay? All right. Now I'm going to look at the medication. So it's a medium dose. It's 100 units insulin, which is a medium dose insulin Lispro recumbent. It's given before meals and at bedtime. Okay, and since it's 1900 and you're about to go to bed, I'm going to give you the medication. It's going to be a subcutaneous injection through the anterior aspects of the thigh, and it's scheduled for now. All right, everything's matching up, the dosages and everything, and I'll be giving you 4 units based on the sliding scale. Okay, all right, so I'm just going to clean my hands real quick. All right, Mr. Simpson, just relax, okay? What I'm going to want you to do is I'm going to expose your blanket, okay? And I'm just going to expose so I can see your leg, all right? I'm going to clean my hand this again. And next thing I'm going to do is I'm going to put some gloves on, okay? Okay. Okay. Do you have any questions before I start, Mr. Simpson? No. No? Okay. Alright. I'm gonna make sure that my gauze is open in case we're bleeding. Okay. I'm gonna take this out. Alright. Next thing I'm gonna do is I'm gonna get the alcohol pad and I'm gonna get the anterior aspects of the thigh. Okay. It's clean, it's dry, but I'm gonna clean this. I'm gonna do a circular motion. I'll go like that. Next, I'm going to get also the gauze and put it in one hand. And next, I'm gonna grab it. And then I'm gonna pinch it. I'm gonna take off the alcohol pad that I just cleaned. Take off the cap, rainbow. And then I'm gonna dart it at 90 degrees since he does have enough adipose tissue. So, I'm going to do, and I'm gonna, alright. And I'm gonna slowly put it into the leg. How are you feeling, Mr. Simpson? I feel okay. You feel good? Okay. So now that I put it in, I'm gonna let go, take it out, and I'm gonna hold it for bleeding. Alright? I'm gonna put the safety on this, and I'm gonna put it in the dirty syringe container. Now look at the cap also goes in there. Alright, I hold. Alright, he stopped bleeding. I'm gonna dispose of it. I'm also going to dispose of this. And I'm going to dispose of the gloves. Alright, Mr. Simpson, how are you feeling? I feel okay. You feel good? Okay. So what we're going to do is I'm going to clean my hands. Assess the location. Alright. The next thing I'm going to do, now that I've cleaned my hands and the medication is in, now I'm going to document the medication. So it is Oscar Simpson, the person. The medication is a medium dose insulin of Lispro recumbent, 100 units per milliliter. This was done before bed at 1900. Subcutaneous anterior aspect of the thigh. And his blood glucose was 200 and they gave a medium dose. Okay, now I'm going to put the lot number 2 and the manufacturer's number on here. Okay. I'm also going to put the patient's assessment. How are you feeling, Mr. Simpson? Are you feeling dizzy, confused, sweaty, cold? No? No? Okay. I'll make sure I'll come back too, alright, to check on you in an hour to see how you're feeling, okay? 30 minutes to an hour, okay? Okay. Alright. So, jotted information down. Alright. How would you want me to make you comfortable? Fix my bed. Alright. Now we fix the bed, put the bed in the slowest position, put the brakes on, assess for clutter, put the bed rails up, put the call light here. Alright, now that you're comfortable, I'm going to open the curtains, open the door, clean my hands, and now that I cleaned everything, I'm done.